here is your question.
Okay.
All right. So if both of you have read and understood, considering it communication skills station, please begin.
Hello, Mrs. X.
Hello.
Yes, I'm Dr. Mahir, one of the surgical here, doctor here. Can I ask you what is your concern? I have been asked to speak to you about your operation. Can I ask you what is your concerns and what can I help you for?
Yes, doctor. As you told me, I've been planning to do surgery, but I have some questions. I don't know. I'm not sure if you can help me with that.
Yes. I will try to help you as much as possible. So you go for ahead and ask me. It's okay for you.
Okay,
You
thank
feel
you.
free. Okay.
So, can you tell me what are the risk and like of this operation?
Yeah. This operation, which is called, we call it total knee replacement.
Okay.
This have risk, sure. And it's sure that there is no surgical procedure without risk, right? So
Yeah.
there is some risk of bleeding, which can be managed. It's minimal, will be usually minimal amount can be managed. There is also a risk. You should know that there is risk of stiffness, but we will speak to the physiotherapist, and we will try to make exercise on you as early as possible, so that
Okay.
there will be no stiffness. There is also there is pain that this operation is designed to relieve your pain, right? But there is
Yeah.
risk. There is pain due to the surgical procedure, as you know, there is wound like that. So there will
Mhm.
be pain, but the staff the nursing staff will help you to provide medication for this pain. And they could be clicking and clunking in the knee. And there is also risk of infection in your leg and clot formation.
Okay.
These are the risks, but this doesn't mean that they are all going to happen. But yes, we are telling you, you should know this.
Okay. So, should I be eating the morning before coming to the surgery?
No, you should. We advise you that you should not eat at least 6 hours before the operation. But you can drink up to 4 hours to 2 hours before the surgery. You could take drinks, but for food, you should at least 6 hours be fasting from the food.
Okay. How long does it take, the operation?
Yeah, it's difficult to tell the exact time that the operation take, but it's usually take a couple of hours. And then we had also the preparation, the anesthesia time, and also the recovery time. So like a couple of hours.
Okay, so you told me that there will be bleeding.
Yeah.
Is there anything you can do about it?
Yeah, we will try to do our best. You know, we have the best surgeons and experience, so we'll try to do our best in helping you in this to minimize the risks like this.
Okay. So, am I like? Do you give me anything to help me sleep during the operation?
Yes, I will try to make the anesthetist meet you. He will be happy to do this, and then he will speak to you and discuss about the type of anesthesia like this. But generally, we can use this can be like general anesthesia or spinal anesthesia. So you
Okay.
will have this discussion with the anesthetist before the
Okay.
procedure.
How long should I stay in the hospital?
Yes, this depends on the many factors on how you progress and how your physios working with you. So the average is about like 3 days, but this depends on many things. Before you go, before we discharge you, you should check many things. Like we should check that you are able to walk. This with structures or with crutches or this walking stick. We should make sure that you can walk, and we should make sure that you can get up
Okay.
some manage with some stairs, like set of stairs, and we should be sure that you can walk out of the bed and go into the toilet like your regular activities. You can do it safely, and then we should be sure that your wound is healing, and your post-operative X-ray is good. We should be sure that in the X-ray you are making satisfactory result in the X-ray with your new joint, and then we need to make sure that you are free of
That's
pain
good.
and you are medically fit, and your your joint is bending 75. This is required 75 degree in your knee. So so we will be sure that you are all right. Then at that time we will discharge you. But as I told you, it's about 3 days in average to stay in the hospital.
Okay. So when can I return to work?
Yes, this is a good question. So this will be this question will be answered after the operation, like your progress, your knee, how it will be. But the medical staff will be able to tell you when to return to work. But this depends largely on how you and on what you do for living. What you do for living. This will like what you are doing. This will determine when you will go.
Okay. So can I travel after that?
About traveling, we are not recommending to go on airplane for at least this 3 months. And then if you are going with a car like that, we are not recommending also to go for long journey because we feel that you may have clot in your leg, like after the operation. But if it's mandatory, you can try to stop from time to time and walk and move your feet like that. And then we recommend that if you are doing this, you should take care when you getting up in the car or the bus to make sure that not to injure your knee.
Okay. Okay, thank you.
All right,
Yes.
thank you.
Yeah, welcome. So, to summarize with what we have been going through, I advise you that you should not take food at least 6 hours before the operation, and then
Okay.
to take only fluid or liquids for 2 hours before the operation. And then we recommend that not to travel after the operation for the first like 3 months with a flight. And also there is risk of clot. And I ask you to help us in doing this. And this will be prevented in preventing this. Yeah. And this will be prevented mainly by encouraging the movement, early movement and hydration postoperatively. So this is very important. We will also offer you a set of stock that will prevent your leg from getting clogged. And we will also provide you medication for blood thinners. And then, I should also tell you that there will be like redness in your knee that maybe will stay for like couple of weeks. And then there will also be swelling, but operatively that will stay for like 3 months after the operation. That is normal. There is also there is hotness that may stay like 1 year after the operation. This is all normal. You should know this before the operation. So if you have any question so far.
No, thank you. That's all.
Yeah. So if you don't have any question, would you mind to sign the consent if it's okay for you?
Good.
Okay.
Yes. Thank
Yeah.
you.
Okay. I will provide you the copy of the consent. And if you have any question, feel free to ask me. My number will be in the next station. You can call me at any time. Okay.
Thank you.
Okay.
Okay. Thank you.
Thank you.